Hi, my name is Joe, and I'm one of the pharmacists here.
Hi, I'm Mr. X.
Hi, Mr. X. I understand that you want me to measure your blood pressure today.
Yeah, well, my doctor recommended that I should come and get a check.
Good. Okay. I'm glad that you came here. Your doctor recommended it. Are you on any medications for high blood pressure right now?
Well, he says that I'm getting close to the point that I should probably just get checked, and
Okay.
if it gets any higher, I should go and see him.
Okay, great. Okay, I just have a few questions to ask of you before I measure your blood pressure. Have you been seated in this position for at least 5 minutes or so?
I've been sitting for about 10 minutes.
About 10 minutes? Okay, good. And over the past half hour, have you eaten anything that contains caffeine?
No, no coffee.
Okay, are you a smoker?
Yeah, but I haven't smoked since this morning.
You haven't smoked since this morning, so about 2 hours ago, right?
Oh, about 4 hours.
4 hours ago, okay. How much do you typically smoke on an average day?
Wake up in the morning, have a cigarette. That's it. That's the best one of the day. So.
The best one of the day. Okay, well maybe we can actually talk about that some other time.
How to make it better?
How to maybe get you not to have a morning cigarette.
That's tough. But in any case.
Okay, well we'll put that off to another time. Okay.
Yeah.
I'm actually going to give you a wallet card for your blood pressures. Do you actually have one of these already?
No, I don't.
Okay, well I'm going to actually just write down the blood pressure measurement that I measure in here so that you can bring it to your doctor's office. I'll put your name on it along with some other information that might be helpful for you.
Okay, let me know what you're doing so I can follow along.
No problem. What I'm going to do first is I'm just going to, you have your arm already ready, so I'm just going to ask you to put your arm so your palm's up in the air, and I'm going to first place the cuff on your arm. And it looks like you have normal size arms, so I'm going to try out with this normal adult size cuff.
Well, I've tried
to
to
see where I should put it first.
I've tried to cut down on my weight training, so
Oh really?
it's getting a little too bulky.
You normally weight train a lot?
Oh, can't you tell?
Yeah, I can.
Uh,
But maybe that's something you can do in the future. Okay, I'm just going to feel for your pulse to make sure that I place this cuff on appropriately. So usually it's located right in the middle of your arm. You have a tendon that runs right in the middle of your arm, and if you push right to the side of it, sometimes to the medial side, you can feel that pulsation.
You mean towards the middle?
Yep.
Okay.
And you seem to have a pretty strong one on both sides of your tendon, so you got a nice strong pulse. So I feel it right there. What I'm going to do is make sure that the center of this cuff is right above that spot. And when I look at this cuff,
So you mean right where it says artery?
that's right. You see this this arrow for artery goes right over your pulsation of your brachial pulse. Okay. So that's placed appropriately. What I'm going to do actually right now is something that's called an estimated weight, a palpatory method to estimate your blood pressure.
Okay.
You may have never seen this done in an office before. Usually they just strap the cuff on and measure blood pressure, but I'm going to do it the right way.
Oh.
This is how the American Heart Association recommends.
So you're telling me the nurses in the flowery uniform weren't doing it right?
Some of them do and some of them might not.
Okay.
Okay.
That was very diplomatic.
Yeah. Well, some of them do it the right way, huh? So first thing I'm going to feel for your radial pulse, and I feel it right here with my 2 fingers. I never use a thumb. I always use these 2 fingers to feel for your pulse.
So the radial pulse is on my thumb side.
It is on your thumb side, yeah.
Okay.
It goes right down your thumb up into the middle of your arm. And next what I'm going to do is I'm just going to have you hold this you don't have to squeeze it real hard, but hold that, and I'm going to inflate this bulb. And the way that I inflate it is I put the bulb in the palm of my hand, and I pump with these 3 fingers, my latter 3 fingers, and I adjust the bulb with my thumb and my index finger. And the key here is I have to actually tighten up this bulb, so I have to turn it all the way to the right to close it. And when I turn to the left, I loosen it.
So that's righty-tighty, lefty-loosey.
Yeah, you used to work in a hardware store?
No, sometimes I have to do bolts up.
Oh, okay. That's what we used to tell people in a hardware store when they're unscrewing pipe or bolt fittings. So, okay, this is the right way to do it. So I'm going to close the valve. What I'm going to do is I'm going to go really fast up to 70 and see if I still feel your radial pulse. If I still feel your radial pulse at 70, I'm going to go up to 80. If I still feel it again, I'm going to go up to 90. And I'm going to do that in increments of 10 millimeters of mercury until I stop feeling that pulse.
Okay.
And at that point, I can estimate that's approximately what your top blood pressure number is, your systolic blood pressure. I still feel it. 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 It's pretty much gone. And then, since this is an estimation, I just open that valve right up.
That wasn't too bad.
No. I haven't measured it though.
Okay.
When I actually do it the proper way and listen for those sounds, it's going to take a little bit longer.
Okay.
But now I know that your top number is about 140, maybe plus or minus 10. It gives me a place to start.
Well, maybe I should send a doctor.
Yeah, well, let's assume that it's not a problem yet. We'll see
Okay.
what it is. Okay. So I'll put the stethoscope in my ear. And what I'm going to actually do is start off by listening with the bell and not the diaphragm of the stethoscope. This one allows me to hear finer sounds a little bit better.
Mhm.
So I want to be as accurate as possible. So I'm going to try with this one and see if I can hear that.
So can you hear both sides at one time?
Nope. Right now I can only hear the side where the flat part is activated. So I can only hear through this now. I can't hear that.
All right.
I'm going to relocate where I felt your brachial pulse, right about here, right near your ligament. I don't really have to push real hard.
Mm-hmm.
Usually you feel real light with these two fingers. You can feel the pulse. Some people it's a little bit harder. You might have to push down a little bit firmer to get that pulsation, but yours is nice and strong. I feel it right there. I'm going to put the head of my stethoscope, the bell, right over where I feel that. And I really want to make sure that the head of the stethoscope is on your skin, because I can hear it a little bit better. Some people do it over clothing, and that's okay, but it's not as good as having this on directly on your skin.
Okay.
And I'm also going to make sure that there's about a 1-inch margin between the top of this head of the stethoscope and the bottom of your cuff. Because if I don't do that, I can hear that ruffling of the head of the stethoscope against your cuff.
Got it.
So I'm going to hold that there. And now that I know, based on the estimation, that your top number is around 140, I'm going to add about 30 millimeters of mercury to that as a place to start.
Got it.
Okay. So, as I'm looking at that dial, I'm going to close the valve,
Righty tighty.
righty tight, and I'm going to pump all the way up to about 170, which is 30 plus 140. At that point, I'm going to turn it slightly to the left, a very small turn to the left, to decrease pressure in the cuff.
Okay.
And while that happens, I'm going to be listening through the head of the stethoscope to hear for sounds called crock-off sounds.
So can you hear my pulse now?
No, I cannot. I can only hear it in between your systolic and diastolic blood pressure.
No.
So if your blood pressure was 140 over 90, the only time I can hear through this is when the dial is between 140 and 90. If it's above that, I can't hear anything, and if it's below 90, I can't hear anything either.
So what happens at 90?
At 90, the
Disappear?
sounds will go away.
Okay.
So if your blood pressure was 140 over 90, I would pump this up to 170.
Mm-hmm.
I would open up the valve slightly and not really hear anything. And then somewhere around 140 is where I would hear your first crock-off sound. And each heartbeat, I would hear another crock-off sound as the pressure deflates. And once it gets down to 90, if 90 is your true diastolic blood pressure, those heart sounds would go away.
Is that hard to hear?
Crock-off sounds.
Is it hard to hear it disappear?
Yeah, it is hard to hear it disappear. So I have to ask you to do a few things. When I pump this up, I'm going to ask you not to speak so I can hear it accurately.
You're asking me
I'm going to
now.
ask that you don't cross your legs and that you just relax in your chair.
Okay. I can do that.
You did? Are
Yep.
you all ready, Mr. X?
I'm ready.
Okay. And I'm deflating at a very slow rate of about 2 millimeters of mercury per second. Okay. Okay, Mr. X, good. So, what I always do is I always measure blood pressure twice. I'm going to wait at least 30 seconds, maybe a little bit longer if we need to, just to see if the first measurement was a lot higher than any subsequent measurements. Sometimes it happens and people are a little nervous in the first one. I wait and see if it goes fine.
Okay.
But what I got is 140/90.
Ooh.
After I got to the 90, I actually didn't, I still allowed the pressure to deflate slowly, because I didn't want you to know exactly what your bottom number was, because I have to do a second measurement. But I waited until it got down to about 70 or 60 before I opened up the valve quite a bit to allow all the pressure to rapidly deflate.
So I guess it's a good idea to have some paper and a pen handy to document.
I got my pen, and your piece of paper is going to be your wallet card. Actually, I got this from the internet, and it's from our national government. It helps actually increase awareness of blood pressure.
So I'm getting some of my taxes back.
Well, I don't know about that, because I don't think you pay taxes, do you, Mr. X?
Well, as far as the government knows.
So I'm just going to put down that I measured your blood pressure today, which is September 18th, 2006. And the location, I'm just going to put a little bracketed arrow. This indicates that you were seated, and that it was in your right arm. And we used a normal size cuff, so I don't really have to write down that you used a different size cuff. And I'm going to put 140/90. Now what I'm going to do is I'm going to repeat it and just document another number to see that we have more than one measurement to help your physician decide whether you need medication or
How does it turn out that I was even number?
not. That's a very good question. And the way that blood pressure is supposed to be documented is you always round up to an even number. So if I were to have heard your first crock cough sound at 139, I would have rounded it up to 140. If I would have heard the first crock cough sounds at 135, I would have rounded up to 136. So always round up to an even number. We don't round up in increments of 10, we round up to an even number, which is going up just one from an odd.
So if we're in roulette, you only bet on evens.
I don't play roulette, so I don't know.
Okay.
Okay, do you have any, before I measure your blood pressure a second time, do you have any questions?
No.